color is that? White or clear, okay, that's the brown cells. So right here's the connective tissue, this here's epithelial tissue. So see how the nuclei are closely packed together? That means the cells are closely packed together. These cells are more spread out, okay? And you have fibers and ground substance, the white is the ground substance, okay? This is the small intestine. So you see this here? It looks like a tank ran over it, or a tractor, okay? So it looks like it's chewed up a little bit. That's microvilli. Microvilli are indentations in the cell plasma membrane, okay? So these cells are gonna secrete digestive enzymes, and then when you break down those food, right, those food particles are gonna be absorbed through the cell and go into the blood supply and lymph supply of the connective tissue, okay? That's what they do. Now these guys here, these big, round, fat, happy cells, these are called goblet cells. They secrete mucus, okay? So how you make a slide, right? You take a piece of tissue and you put it in a thing that looks like a deli slicer. It's just small. It makes thin slices of that tissue and it lays it on the slide. This was cut, so cut this cell in half. So this here got cut. That's why the goblet cell's there. Okay? This is why we look at these under the microscope. Okay, so these here, right? Now look at the obvious difference between this and this, the color. And look, all the nuclei are a nice pattern. All these cells are all spread out. This here is the basal membrane. Okay, so this is epithelial tissue, connective tissue. These are ciliated columnar cells. Okay, so if you're looking at this, these are, the microvilli are indentations in the plasma membrane. Okay, cilia are extensions off the plasma membrane. So they're sticking up like that. So what these guys do, this is a fallopian tube or uterine tube. So the lady ovulates, okay, these little hairs, the cilia, push the ovum to the site of fertilization, okay? All right, if you're looking at this now, the obvious difference between this and this is more red, the color, okay? This is the basal membrane, see that pretty easy, okay? Now all these cells, when you look at them, and you know they're elongated cells, but at first glance, it looks like there's multiple layers. There's really not. They're kind of just all squished in together there, okay? So they call that pseudostratified, okay? Oops. Pseudostratified. So it's ciliated, there's a cilia, so it's called pseudostratified ciliated columnar epithelium, okay? The big white cells here, big fat happy white cells, these are goblet cells. Okay, so goblet cells secrete mucus. It's gonna be in your trachea. So any debris you breathe in, okay, dust and stuff, the mucus will catch that, okay? Will catch it, okay? The cilia will kick it back up to the throat, you will cough it up, spit it out, or you swallow it, and the stomach acid will take care of it, okay? All right, so look at this here. See the obvious difference here is the color. Underlying connective tissue, okay? There's only 200 times normal vision, that's why it looks small, okay? But look at these cells, how very closely packed they are together. They're flat cells, okay? Multiple layers of flat cells, okay? It's stratified squamous, okay? This is a vaginal opening here. So what happens here with intercourse, with normal hygiene, washing, you're gonna slough these cells. They're gonna get damaged. So the underlying cells, as these get damaged and slough off, okay, they're gonna be replaced. Okay, this happens in skin also, but those cells, top layer cells in the skin are dead cells. Okay, that's for protection. Okay, that's for protecting. The vagina is a mucous membrane, so you can secrete mucus. Okay? All right, so looking at these cells, these are square cells. I know they kind of look like they're circles, they're not. The circles are the nucleus. The circles are the nucleus, okay? Like this. The circles are gonna be in the nucleus. They tend to take up the whole cell. All right, so this is the cell plasma membrane. That's the plasma membrane, just like that. So they are actually square cells, okay? So, 2 or more layers of square cells, right? Stratified cuboidal, stratified cuboidal. This is on the top portion of your esophagus, okay? More towards your throat and mouth, okay? Closer to the stomach here, and look at the obvious thing is color. Look at our fibers here, right? The cells are spread out. That's the connective tissue. Okay. Now, if you're looking at these here, okay, these here are elongated cells, right? That's the stuff. They're elongated, right? Okay, so when these cells get sloughed off, okay, these cells get sloughed off, these guys here stand up, and these here divide, and those divide, okay? This here is also an esophagus, okay? All right, this is lower to the stomach, okay? These are longer because there's more wear and tear. Every time you get acid reflux, that's the stomach acid hitting your esophagus, okay? They're gonna get damaged, but we replace them, okay? And right here's all the connective tissue, okay? All right, so if you look at these cells, these are transitional cells. Well, let me do this. And these are transitional cells, okay? These change shape. This is a urinary bladder. So when you get urine in your bladder, it stretches, right? This here is the basement membrane right here. And the basement membrane, right? All like that. Okay? Epithelial tissue, connective tissue. Now, a little trick here is the fibers in transitional, okay? The connective tissue fibers, okay? They're like coils. See that? This is a good one right here. Okay, so these guys, these are elastic fibers. They're gonna stretch, then they go back to normal. They'll stretch and they'll go back to normal, okay? So anytime, like if you're looking on a test, like not in here, but we get like cytology classes, okay? If, a lot of people mistake this for squamous cells, but they're not flat. See, watch, let me go back. See, these are flat. These are very flat. Okay, these look like more rounded than anything else. Okay, but if you look at the connective tissue underneath, the elastic connective tissue, you know it's transition. Okay, we have two types of glands which we'll go over. Okay, when we do endocrine system, but we have exocrine glands and endocrine glands. So if we use the pancreas, pancreas has both exocrine and endocrine glands. They have both. Okay, exocrine glands secrete through a duct is a tube, into a hollow organ. So we said when we saw this in Dava, right? 99% of the pancreas are Acini cells. That's for digestion. So they secrete their enzymes through a duct. It's called the pancreatic duct, and it empties into the duodenum of the small intestine. That is the hollow cavity. Okay? Endocrine, that's the exocrine gland. Endocrine, here, soriferous glands, these are sweat glands. They secrete on top of the skin. Salivary glands secrete in the mouth. Okay, they all have tubes. Okay, endocrine glands have no tubes. Okay, they secrete directly into the blood. Okay, and the blood takes it to where it's gonna go. Okay, so the tail of the pancreas, right? We have alpha cells secrete glucagon right to the blood. Okay, it's gonna help break down glycogen. Okay, beta cells secrete insulin. Helps pull glucose out of blood into the cells to make energy. Okay, don't worry about that. Don't worry about that. Don't worry about that. Okay. This here's a sweat gland, so use a cuboidal cell, okay? Thyroid gland looks like no other type of gland here. This here's all thyroid hormone. The thyroid gland sits right under your larynx, okay, right under your larynx, okay? It secretes thyroid hormone, triiodothyronine, okay, and tetraiodothyronine, which we call thyroxine. It's where it controls your metabolic rate, controls metabolism, okay? So here, right, single layer of cube-shaped shells. Okay, here's another one. This is a blood vessel. Okay? All right, connective tissue. Do we have time to let's start connective tissue. Let's start. Okay, so this is the next type of tissue. Okay? So connective tissue is going to bind, okay, structures together, okay, like ligaments, right? Attach bone to bone. Okay? It's gonna give us some support. That would be our bone. Okay? It's gonna give us some strength. Ligaments, tendons, right? Holding the joint together. It's gonna give us some protection. Fat around organs. Okay? Skull around the brain. Vertebral column around the spinal cord. Okay? It's gonna compartmentalize us. Okay? So thoracic cavity, abdominal pelvic cavity, you know, with the ribs and sternum. Okay? Transport, right? We're gonna transport oxygen and CO2 in blood and nutrients, and we're gonna transport fat-soluble vitamins, white blood cells, and dietary lipids in our lymph, which will go over all that. It's gonna store energy, again, fat cells, and elicit an immune response, blood and lymph, okay? So connective tissue is the most abundant tissue. Connective tissue is the most abundant tissue. It's gonna look a lot different than epithelial tissue, and it's gonna have, different functions. So in connective tissue, we're gonna have cells. These are the cells. Fibroblasts. Macrophage is the type of white blood cell. It's a big cell that eats. Phage means to eat. Okay, we got our fat cells in here. Neutrophils, eosinophils, basophils, these are all types of white blood cells that fight infection. Plasma cells are a type of white blood cell that secretes antibodies. Antibodies kill a wide variety of organisms that get in your body. Antibiotics that you get from the nurse or the doctor only go kill bacteria. If you have a virus, you gotta take an antiviral drug. If you have a fungal infection, you gotta take an antifungal drug, okay? If you have a raging viral infection, they might give you antibiotics just to prevent a secondary bacterial infection because your immune system's going down, okay? Okay, fast cells along the line of our blood vessels, they release histamine, okay? All right, so those are the cells. Okay, then we have these big fibers here, big fibers, okay? Fibroblasts lay down the fibers and ground substance. They make the chemicals that lay down the fibers and ground substance. So, whoops, what I just, all right, all this is like, with the beigey material here, okay? Think of that as the cement, that's the ground substance. All these lines and fibers, these are the fibers. So the thick ones are collagen fibers, the little thinner ones here, okay? These here are gonna be elastic fibers, and then, like the little skinny ones are gonna be reticular fibers. They're gonna be more reticular fibers, okay? All right? So, characteristics of connective tissue, please know this. We have cells, ground substance, and fibers. The ground substance and fibers we collectively call ground substance, okay? Right? So the ground substance and the fibers, okay, we collectively call the matrix. Okay, now, connective tissue does not cover body surfaces, it does not line hollow organs. It has a nerve supply, except for cartilage. Okay, except for cartilage, no nerve supply. They're usually highly vascular, like the dermis of skin. Okay, you all right? All right, go outside, take a couple deep breaths. Okay. So skin's highly vascular, actually used as a blood reserve, okay? Except for cartilage. Cartilage has no blood supply. Ligaments and tendons have little blood supply. So bone is very vascular. So you break a bone, okay? You break a bone, depending on a bone, 6 to 8 weeks, the bone's healed, and you basically heal it stronger where it's broken, okay? How long could it take if you tore a ligament or a tendon? It could take 10 months to a year to heal, if it heals properly, okay? Because it doesn't have a lot of blood supply. Your fastest healing organ is your eye. Your eyeball has a lot of blood supply. You scratch your cornea, it hurts. The next day you're fine, okay? So the eye heals very, very quickly. Rip the optic nerve out, you're fine. Okay, so these are the cells, okay, connective tissue. We have our fibroblasts. These make the chemicals that form the matrix, the ground substance and our fibers. The ground substance and our fibers, okay? Okay. Macrophage, okay. Macro means big, phage means to eat, and lab, we're gonna go over those different names. Okay, we used to call these cystocytes. Okay, these here protect us from invading microorganisms. Okay, they can engulf bacteria. They'll chew up any cellular debris, like from an injury. Okay, and the process is called phagocytosis. So, osis means condition of, cyte means cell, phage means to eat, condition of a cell eating. It'll engulf foreign material, it'll engulf a cell that has been invaded by a virus, and will engulf bacteria cells and kill them, okay? Plasma cells secrete antibodies, they kill a wide variety of organisms in our body, okay? And mast cells are gonna be along the line of our blood vessels. They secrete histamine, okay? So if you get an infection, like, if you get an infection, an allergic reaction, or any type of trauma, okay, you are going to inflame. You are going to inflame, because you're gonna have a histamine reaction, okay? So what happens here is, right, these mast cells secrete histamine. Histamine allows your blood vessels to dilate, so more blood's gonna get into the area. So if you have like the rhinovirus, you have a head cold, how do you feel? What's your symptoms? What's your symptoms, right? Your nose gets red, your eyes get red, you feel real stuffy, right? Real stuffy. What's happening here is your blood vessels are dilating, so you get more blood into the area, so your white blood cells can fight the infection. So if you have a cold or you have your allergies, right, your seasonal allergies, what do you take to feel better? You take an antihistamine. Prevents the mast cells from secreting histamine, and those blood vessels will not dilate. You'll stay sicker longer because you're not fighting it, but it'll get you through the day. Okay? Right. Other types of cells, right, adipocytes are fat cells. We store our triglycerides in there. Leukocytes are our white blood cells. Okay? Okay, so this is gonna be our ground substance now. So we did our cells. This is what the cells make now, it's fibroblasts. So hyaluronic acid, you hear about this, right, on TV, commercials and all. This is very viscous, it means oily and slippery. Okay, it's gonna lubricate our joints. It's also gonna help, phagocytes, those white blood cells, migrate through the connective tissue, okay? To help us fix a wound, like if you damage a joint, okay? Chondroitin sulfate, you might see also, this is a jelly-like substances. These provide support in cartilage, in bone, in skin, and blood vessels, and also okay, first they do the tongue, adhesiveness, sorry. Okay? So glucosamine sulfate, same thing. So as a chiropractor years ago, they sell it in nutrient form, like a vitamin, and people that have like severe osteoarthritis, you say, listen, why don't you take some glucosamine sulfate? It helps rebuild the joint. Some people said it didn't work, but are they really taking it and doing their exercises? Who knew? Some people said, my God, this is great, it changed my life. Okay, I had this lady, she was very obese, she walked with 2 canes, when she go to the mall, she had to be in a wheelchair. Started coming in, we started adjusting her. After about 9 months, she was going to Atlantic City. Okay, her joints were great, she didn't need the surgery. Okay, and some people, they said, well, if I take it, I feel better, if I don't take it, I feel worse. So, just depends on the person. Okay, good. Adhesive proteins, these interact with our plasma membranes, they're gonna anchor cells together. They're gonna anchor cells together, it's like the glue. Okay? Okay, now we got the connective tissue fibers. Then after we do the fibers, we'll let you go. Okay? We have 3 types of fibers. These are gonna be in the matrix. Collagen fibers are the biggest, they're very, very tough. Okay, but they have some flexibility. We're gonna find connective fibers in bone, cartilage, tendons, and ligaments. They consist of the protein. That protein is called collagen. And that protein is called collagen. Okay? Okay? The next one is gonna be elastic fibers. Elastic fibers have the protein elastin. These are gonna stretch 150% and bounce back. You're gonna find this in skin, right? You can stretch your skin. Blood vessels, okay, especially arteries. Okay, large arteries, right? The blood's coming right from the heart. They gotta stretch. Okay, and in the lungs. Okay, sometimes you do break these elastic fibers in your skin. Okay, bodybuilders get that. Okay, pregnant ladies get that. What do you think that's called? When you break elastic fiber. Stretch marks, we got it, stretch marks. Okay? Last one is reticular fiber. This is collagen fiber that has a glucose coat around it, a glycoprotein around it. Okay? This makes a framework. Okay? This here is going to be like, you see reticular fibers in the liver, in the red bone marrow, in lymph nodes, okay? In blood vessels, around adipocytes and nerve fibers. Okay? So, we went over all the cells that make up connective tissue, the ground substance and the fibers. Okay, so now just think, we're gonna go over cartilage next. So we have different structures, we're gonna have more or less of something. So like elastic cartilage, we are going to have more elastic fibers. Okay, fibrocartilage, we're gonna have more collagen fibers. Okay, all right? So what we're gonna do on Tuesday, we're gonna go over the types of connective tissue. There's two types, loose connective tissue and dense connective tissue. Then we're gonna go over the type of cartilage and we're done. Okay, so next Tuesday we'll be finished with tissues, and we are a little bit ahead, which is good. Okay, so we'll let you go now.